welcome here today on a great occasion as we define better than normal. This is what we call better than normal. Hartford Hospital and Hartford Healthcare promise for personalized coordinated care for all the people. Today, this opening directly and squarely addresses the health equity and healthcare access. And I couldn't be more proud standing here representing 30,000 individuals of Hartford Healthcare that made this promise and are keeping this promise. Through 7 hospitals, 9 emergency departments, 450 different locations, diagnostics, procedural, surgical centers, physician offices like right here, home health, rehab services, long-term care, and now this retail and specialty pharmacy services completes our portfolio of services for our community and for our patients. Hartford Healthcare is today one-stop shop delivery system in the state of Connecticut, one of the most profoundly developing and keeping its promises in caring for our communities. Nearly 6 years ago, we envisioned what is happening today. From serving merely 80 patients a day, this location today serves more than 400. Coordination of care is provided through specialty services in partnering with our Shields Pharmacy that has expanded our horizon across the state. These services are welcomed by our patients and by our physicians. They are greatly appreciated, and the patients have highly recognized and rated these services. As a pharmacist in my prior profession, in my earlier career, I knew well what pharmacists meant to patients and what patients meant to pharmacists. One of the highest trusted professions in the eyes of patients, I'm proud to say that during the COVID years and COVID time, this was no different. This pharmacy and this pharmacist and the techs provided much needed vaccination access and support for our community, including serving vaccination through this location. That was the promise made, and that's the promise kept. Only possible with the team. It takes a village, individuals who shepherded this process and took pride and key roles are Bree Nichols, the pharmacy director, and Eric Arlia, who is the system director of pharmacy. I'm absolutely and so grateful for their discretionary efforts and the pure selfless commitments that they have made on behalf of all of us. Eric Arlia is our system director across Hartford Healthcare. Let me introduce him here, a genuine, humble leader in this journey. Eric?
Good morning, everybody. My name is Eric Arlia. I am the Senior Director of Pharmacy for Hartford Healthcare. And I just want to thank everyone sincerely for coming today. We are really excited to celebrate this moment. It's been a long time in the making, and I want to start out by just expressing my gratitude to Jeff Flax and Bimal Patel and all of HHC leadership for investing in our pharmacy. This physical facility will give us the ability to serve many different patient types well, and Bree Nichols, our pharmacy director for specialty and retail, is going to give you some of the details on that. We are well positioned to be here for many years in this great facility, and we're really excited to be opening it up. I also have the privilege of being a member of Hartford Healthcare's COVID vaccine task force, and as I've done a few times in the past, I'm happy today to give everyone an update on where we stand with vaccinations. And I want to focus a little bit on some of the things that pharmacists have done today, because I am just incredibly proud of the HHC pharmacy team. So to date, we have administered over 301,000 vaccines across Hartford Healthcare. Of those vaccines, 215,000 of them were Pfizer. And as many of you know, the Pfizer vaccine requires some preparation before it's being used. Hartford Healthcare pharmacists have prepared virtually 100% of those doses That's almost 36,000 vials.
Pharmacist coverage in all of our vaccine clinics to provide that service. Additionally, we have, as direct vaccinators, we have vaccinated more than 25,000 people in that group of 300,000. And I see a lot of my pharmacy leadership team out here today, and I just want to tell all of you how thankful I am for how hard you have all worked and how much it means to me, and the fact that we're able to keep other things going, such as the finalization of this pharmacy, is just a testament to how hard all of you have worked and how much you've worked together, and I really greatly appreciate it. I also wanted to give everyone an update. It's been a really exciting week. Yesterday, everyone heard about the launching of vaccinations in the emergency departments. We also just finished up having the privilege of being the first system in the country to have the FEMA vaccine trailer. So I wanted to just share some of the final numbers from that. So in the 10 days that we operated the FEMA trailer in Bridgeport, we vaccinated 3,256 people. Of those, 98% of them, over 3,200 of them, lived in the city of Bridgeport. And to Bimmel's point, our goal is to get into the hard-to-reach areas to make sure that people that have access and computer issues have the ability to get to the vaccine. And I know that our team worked really hard. It's not easy going first, and they figured out the best way to do that, and we hope that other systems that use the trailer in the state will build on the work we've done. We will also get the trailer back for turns in New London and back in Bridgeport while it's still here in the state. Also of note, 56% of the people who we serviced were of people of color, and 14% of them were white, so it was a really good way to hit at our diversity goals. So again, we are honored and privileged to have been the first organization in the country to do that. So that's just a little bit of a vaccine update for you. I get to put my dual hats on here today. So again, I want to just thank everyone for coming, and I really want to just express my gratitude to my pharmacy team for how hard all of you guys have been working throughout the pandemic. So let me introduce to you the person who really makes this pharmacy happen now. She has been here at Hartford Hospital for 4 years, and I cannot imagine that we would have gotten this far with this process without her. She is tremendously talented, and she does a great job with her staff and with her patients. And I'm happy to introduce Brianne Nichols, the System Director for Specialty and Retail Pharmacy, to tell you a little bit more about the services that we're able to provide here.
Good morning and welcome. My staff and I are very excited to be finally opening our pharmacy. This new space offers us much more space, in which we will be able to service all of our different community members. Hartford Healthcare Community Pharmacy is an accredited specialty pharmacy, which means we dispense expensive and high monitoring medications. These medications are important for everyone for their disease state. These medications are expensive and require more monitoring by our providers and pharmacists. A highlight of our program is for financial assistance. Since these medications are expensive, they require financial assistance. Our patients are able to focus more on their health rather than the cost of their copay. This program is far-reaching. It's in all of our regions, and our patients are spread all across Connecticut. This pharmacy will allow us to expand in our shipping with our new space. This pharmacy also provides a meds-to-bed service for patients that are discharges from both Hartford Hospital and our Bone and Joint Institute. This service provides patients their medications at their bedside before they leave. Our community pharmacy also services our community members. We still offer a free delivery service for patients in the Hartford area zip codes. Lastly, our pharmacy also helps with employee prescriptions. We're excited to be able to expand this service in this space in order to accommodate our many employees across the system. Hartford Healthcare Community Pharmacy strives to help all of our patients across the system, and we're very excited to be able to close this continuum of care and provide the best service to all our patients. Right now, I'm excited to present one of our liver transplant patients who is a very well-loved and dear member of our pharmacy. We invite him into our new consult room to be the very first patient to get a COVID vaccine in our new space. I'd like to welcome Edwin Aquino in order to get your COVID vaccine.
I think you can take a seat here. Have you been waiting a long time for this?
Yes, I have. Yes, I have.
You want to do right or left arm?
Right,
Right
like
arm.
this.
Perfect. All right, you ready? Big day. Here it is. Yay! How does it feel?
Good, I'm excited.
Good. It didn't hurt, right?
No,
Good.
not at all.
Good. Why did you want that vaccine?
Because it's been too long. Everybody's been waiting for this vaccine. And I'm the first one here now. I've been waiting for a while too to get it.
Congratulations, Edwin.
Thank you, thank you.
Thanks, Edwin. Yeah, I'm gonna, if you're ready, I didn't join.
You have to come in front. You have to come in front. This is your show.